So our next talk is by the wonderful Jasmine Smith, who is the CEO of Rejuve.AI. And as you can see, this will be a bit of a change of pace. It will not be talking about wet lab work, but rather AI. So, Jasmine.
Thank you. All right. Everyone can hear me great. Yeah, so in a way, this is kind of tying together all of the previous themes. This is about the hard problem that I'm going to make a case for that really isn't that hard if we put in the work, and that's scaling N-of-1. So I just feel the need to do a little bit of an intro, just because I'm a little bit of a newcomer. I've been in the longevity space, I guess, proper for a couple of years, but I've kind of been a radical life extensionist my whole life, pretty much, since I was a kid. I started out in health information management, so I was working with health data. And pretty much the job became kind of depressing. I was just kind of calculating the monetary cost of people's suffering and death, and I just felt like, that wasn't the best contribution. And then I kind of got into crypto and AI through my co-founder, Dr. Ben Goertzel, who many of you probably know, because I know he's been here quite a few times. Yeah, so that's me. And so now biohacking has become an entire industry. Most people are kind of getting their top health advice from influencers like Brian Johnson, Andrew Huberman, et cetera. And it's growing in popularity as well because of health apps, AI, ChatGPT, wearables, all this kind of a thing. But this is something that, the data is still very not standardized. And it makes it even more difficult because sometimes even the scientific findings themselves clash. We all know about the scenarios to where, one day something's good for you, the next day it's bad. Is it carnivore diet that's the best, or is it plant-based? Is a little bit of wine good for you, or total abstinence from alcohol is the thing? Is the sunlight good for you to get vitamin D, or will it give you cancer? There's all these different kind of conflicting things. And honestly, it depends on the scenarios and the person. So there's lots more that can be kind of discovered here. And so there's kind of this, what I call a spectrum of anecdotal evidence. And this kind of ranges from what I've named medical miracles. So maybe you've heard of someone called Stamatis Mouratis, which I don't know if I'm pronouncing the Greek correctly. But this was a guy who apparently, and this was on the New York Times, he got diagnosed with terminal lung cancer. And he went back to his home country of Icaria, Greece, which is also a blue zone. And he was pretty much given 6 months to live, and he did not undergo any treatment. He simply just moved to Icaria and just thought he was going to just die there. And he ended up living to 100 or maybe 90 something. There's kind of conflicting stories about how old he was, but he lived pretty much to 100 years old after being given a terminal cancer diagnosis. So these things are amazing, and I mean, spontaneous remission is a real phenomenon. But then in the middle, which is kind of where we are mostly right now, is that there are kind of extreme stories, and maybe even some of you in this room have had some experience with this, where someone claims to have cured themselves of cancer with a natural protocol or reverse some kind of chronic disease, and it may very well be true, but then if someone else tries it, they might actually die. And there's been some tragic cases of that. And actually, my own mother was one of them. She passed away from breast cancer a few years ago. She refused treatment, did some kind of unsupervised holistic medicine, and things did not go well, to say the least. And then there's the downright deception, so-called snake oil, people actually just lying and making things up, which I feel like that's kind of on its way out, given that everybody has the internet now and is very more astute to information. So how can we actually separate signal from noise? And better yet, how do we amplify the signal to actually be useful for more people and have more of those cases on the far left? And so we have this problem like an anecdotal bottleneck that when all of this data, whether it's simple biohacking or actual cures, there's no standardization or validation possible of this because it's all siloed. It's individual stories. It's medical records locked up in one place, or maybe there's not even any record. So this data is just being lost, and that becomes not actionable. The claims lack the context to actually be replicated. And on top of it, biology is just complex. So what works for one person may indeed not work for the other. But there are times where maybe it does work for everyone. There's some standardized approaches that do, but even those, there's certain times and scenarios to which you have to apply them in order for them to be maximally effective. So how do we actually address and solve this? By building a structured N-of-1 ecosystem. So basically now we have all of these digital tools, cell phones, apps, AI. We can collect the data and create kind of standardized protocols to be able to do decentralized N-of-1 trials. and shareable protocols to be able to actually collect this data in a more structured way. And then we can convert this into actual evidence, and then turn that evidence into aggregated insights, and then this becomes actual science instead of just this person's one story about something that really worked. And this is really what needs to be done now that we have all of these tools, and I'm about to get into kind of the problems. First, so more about scaling N-of-1 insights for precision protocols. So the idea is that you want something that's uniquely going to work for you. You want a protocol that you can follow to where you know for sure that you're not going to have any negative effects. You're going to be the optimal health that you possibly can. You're going to be taking the right things when you need them and not taking things that you don't need, all that kind of a thing. So first we have to standardize the data capture, and importantly, it has to be global. Right now, a lot of the research data sets everybody's kind of using the same few, NHANES, UK Biobank, et cetera. We need more data from all over the world to have more representative population, including even women. So we just need a lot more going there. And then we analyze it using the AI that's available now, and even new emerging AI techniques that continue to be developed. And then we can personalize the interventions via individual responses and cohort-level insights. And then the idea is to refine these protocols continuously through longitudinal feedback and iteration. So the more data that we have about how these things work for individuals and in what circumstances, whether it's genomic, just regional, cultural, all that sort of thing, we can refine what works best. And so now we're going to get into the hard problem. So it's like, OK, that all sounds great. Why aren't we already doing this? So participant engagement, this is something that's a problem even in normal clinical trials as well. How do we make sure that people are actually adhering to the protocols that were prescribed? How do we know that they're doing anything consistently and that we can trust the data quality? The data privacy and security, always a massive one. We already heard about big data breaches and sale of data like 23andMe and et cetera. And then there's the scientific rigor behind it. How do we make sure that this is actually meeting all of the protocols and being reproducible by others? And then there's the algorithmic bias that I kind of touched on with the globalness of it. There's a risk of replicating health disparities that already exist. We kind of see that already in some of the early AI models, to where it's kind of replicating the same kind of biases that already exist in the human population. And then we have regulatory and ethical risks, inconsistent access to certain interventions and therapies, and then the blurred lines in between kind of tracking what people are already going to do, whether you tell them to or not, and actually recommending them to do something that might actually be harmful to them. So the inevitable solutions, the good news is that they're already here. Adoption and engagement. Gamification, everybody loves games, and this is Vegas, so a good place to kind of mention that. And we can also utilize microlearning as well to be able to create positive behavioral feedback loops, to be able to not only adhere to the protocols, but actually understand and connect with their personal data even more, so that it becomes something that they're actually competing against themselves to get better and better at, and according to standards that are made by the experts. For data privacy and security, we already kind of have all of the frameworks in place, and really, it's usually overstated, because if you're using a cell phone, if you're using ChatGPT, et cetera, you're already sharing. Your data is not private, but we do expect there to be some sort of windows and doors around things, and those frameworks already exist, but we can enhance that even further with blockchain technology. And I know that a little bit of that has been mentioned in some of the earlier talks yesterday, so that this is a more secure way to be able to transfer information between each other. And the blockchain also has immutable records of kind of where things went, so very convenient that way. On the scientific rigor, AI-driven consensus modeling is an approach that can be used to basically model the consensus of where the science is at the moment, and then be able to make an adaptive kind of system that modifies itself with more and more data, so that it can kind of detect whether or not the consensus needs to be updated, or whether it's pretty on point to what's actually happening in the real world. And decentralized science, which is again tied to the kind of blockchain space, is changing the game. It's enabling diverse collaboration and retirement of legacy systems. So this is really exciting. On the algorithmic bias point, digital health tools, again, mobile phone penetration is increasing all over the world. And we can now create globally diverse training data sets that kind of take culture in mind to be able to mitigate this problem. And then ethicatory and regulatory alignment. So a previous speaker, Mac, talked about special jurisdictions and economic zones. We also have one out there that I was speaking to yesterday as well. So this is something that's happening right now. And also medical tourism has always been around, but it continues to mature and get more trusted as we continue on. And then, of course, cryptocurrencies kind of enable global transactions as well. So AI, blockchain, digital health are not just buzzwords, but they're real technologies that are already being deployed. And I wanted to just talk a little bit about the unique role of longevity clinics, which there's several of them here, which is awesome. So the thing is that longevity and healthcare should not really be separate words, because obviously if you are going to seek healthcare, you're going to get better from some kind of condition or be healthier, and the goal is not be healthy so that you can drop dead tomorrow. So this is kind of the same thing. So right now we have this problem that longevity clinics are very upmarket, upscale, and not everybody can afford to go to these kind of things. But one thing that can be done between these clinics is collaboration on a decentralized network to be able to enable longitudinal tracking of the interventions and tests that people are getting, and also the protocols and recommendations and how they're actually working out, so that we can aggregate and standardize this, and then apply AI tools in real-time decision support, and also for continuous optimization of these protocols across different populations. And this will ultimately lead to reduced costs over time through evidence. The more that we kind of can prove scientifically up to standards that certain approaches and protocols work, they should be able to be covered under basic healthcare insurance, and pretty much close this divide between what longevity is and what just basic healthcare is. Thank you. So yeah, the time is now. N-of-1 studies offer valuable insights, but without the standardization, the scientific potential is lost. Data from successes and failures are valuable. Of course, we don't want failures. We don't want people to become sick or be harmed, but that data is still valuable so that it can stop that from happening to more people. And the outliers and amazing things are not just anomalies, they're opportunities that we can understand why exactly that happened and what we can learn from it to enable more people to have these outcomes. So don't dismiss the anecdotes, investigate them rigorously, and turn rare stories into reproducible science. And just a quick acknowledgement to some team and partners, not our whole team, but pretty much our research medical team. And that's all. You can connect with me on LinkedIn and learn more about Rejuve and visit our booth.
Good job, thank you. So we have a couple of minutes for questions, if anyone has any. I don't see anybody at the microphone right now, but I see various people running in the general direction of the microphone. All right. That was hysterical. Gennady. The microphone's not working.
Is it working?
Yes, now it is, yep.
Hello. Yes, it's working now. All right. Thank you very much. I'm curious what you think about the potential for using AI to investigate historical claims of either extraordinary longevity or perhaps certain kinds of health outcomes. Obviously, the individuals in question are no longer around to self-report their results, but could certain AI tools, for instance, discern certain patterns in their accounts that could then be evaluated for plausibility or compatibility with current and emerging medical evidence, so that we might be able to either confirm or disconfirm that, say, a longevity claim from 500 years ago is plausible?
That's a very interesting question, and I'm actually really interested in ancient history. We actually posted a blog post about ancient longevity and things. So I don't know that we'll be able to kind of go back in time unless we do something with quantum space-time technology. But what we can do is validate claims of people that are already alive. There's lots of people who already claim to be, over 100, over 120, 200, all those kind of things. And the more that we can get these tests refined, maybe we can learn something there. So that's my answer.
My question was also about artificial intelligence, because you have Rejuve.Bio, but also Rejuve.AI. And if you want to expand on that, but otherwise I defer to Bill.
My one question is, do you have an existing database established now that will enable us to analyze a lot of data that we're collecting?
Yes, in the early stage, but yeah, we've already kind of launched our application and we're building out the platform. So yeah, this is indeed, I didn't do a product pitch, but this is what we're building. So yes.
Very good. We'll be in touch with you. We want to
Awesome.
analyze a lot of data. Thank you.
All right, thank you.